Our second scenario is an employee with a COVID-19 exposure. So again, this is the employee doesn't directly have symptoms or feel sick, but they came in contact with someone who was confirmed to have COVID-19. If they report an exposure, which you should be screening for at the beginning of every shift, they should go home immediately and call their healthcare provider. If the healthcare provider determines that they have had a COVID-19 exposure, they are going to have to quarantine for 14 days from the last close contact. And again, even if they test negative, they have to quarantine for the full 14 days. In this case, you don't necessarily have to report to the county because it was an exposure, but you should highly consider treating it as a potential case of COVID-19 in the sense of sanitizing the work areas, notifying close contacts of that employee, making sure that they're extra vigilant if they have any symptoms at all, that they should be watching out, especially for the possibility that they might have been exposed. And then again, this type of leave does qualify for paid sick leave. If the employee ends up testing positive, then you do want to follow the flow sheet for reporting. An example of this was in a workplace, one employee reported that someone in his household was sick and was being evaluated for COVID-19, but it wasn't confirmed yet. In this case, the employer did the right thing, told them to stay home and get tested. Eventually, the employee did test positive, but because he had been working from home, they were able to prevent any possible exposures of his coworkers in the workplace. So that's why even if an employee was exposed to COVID-19, you want to make sure that you're following these steps. And finally, of course, if an employee tests positive, they shouldn't be coming to work. They should have probably already been instructed on staying home, but if they haven't received instructions for self-isolation, they should call their healthcare provider or 211 to get that information. And then you as an employer, should be following all the steps of the flow sheet to identify close contacts, letting them know that they've been exposed to COVID-19, reporting to the county, and reporting to Cal OSHA if that is required for your business. So just a recap of this portion of the presentation, how to implement safety in your business. The first and most important thing is communicating with your employees. You want to make sure that they know about your safety policies, the preventive measures that you're putting in place. And you want to make sure that they know what's going to happen if they do have symptoms of COVID-19. You want to have a protocol for that and make sure that everyone is informed and aware so that you can take action immediately. Again, social distancing, face mask sanitation, we're all tired of it, but it's essential that it keeps going, especially since COVID is becoming more prevalent in our community right now. Again, refer to industry-specific guidelines for your safety measures in your business. And follow the county flow chart if an employee is symptomatic. And then finally, it's never a bad idea if you have any doubts or questions, calling the Department of Health, calling 211 for more information and guidance. They will be able to connect you with any resources that you need related to safety.